When this whole incident came to light, we gathered together our team to analyze the case. In doing that, part of that analysis is looking at the case record. And in doing that, we found that this particular caseworker's documentation was current in regards to home visits, collateral contacts, case plans. That was all current and up to date. What was absent were the activity logs for the parent-child visitations. What we came to learn is that this worker, as well as a couple others, were under the impression that they did not have to enter those activity logs for the visitations unless something significant happened during one of the visits. So at that point, we made the decision to update the record, which basically meant putting in what should have been put in all along, that even though it was late, it was better late than never being put in. And the information we were putting in was factual information that we had at our fingertips. Dates of the visits, who was present at the visits. That was all information we had in the calendars, in the sign-in sheets in the lobby. So we had that information at our fingertips, so we said, put that in the record. So it would remain in the record, for the life of the case, as well as the fact that our state review agency was going to review the record. And in doing so, they don't come to our agency and sit at our desks and review the record. They do it via their desk in Columbus, Cleveland. So if it's not in the state computer system, they're not going to see it. So we made that decision to update the record very openly, it was not done covertly, it was not done behind closed doors, and it was putting in, again, what we already knew. And in addition to that, when you put information into the state computer, it's all time-stamped. There's no way of making it appear as if it had already been put in there, at the time it occurred. So we knew that. We knew that the state was going to see that it was late being put in by that timestamp, but we were okay with that. We said we'll take the hit with being late with the documentation, but at least it's in there.
I felt it was important for the child's life to have everything in the record. We realize that workers sometimes keep notes at their desk, they do things at their desk and enter them in later. So we were not trying to not put it in. We knew we were going to be late. We knew that was going to be something the state would be saying, you need to fix that. ODJFS is our oversight agency. They never found any problem with our visitation that was being provided and the level of supervision that was being provided with regards to this matter. What they found a problem with was our documentation not being timely. So that's, I think, been kind of overlooked in this whole process.
There was one piece of what we put in that was could be seen as misleading. In addition to putting in the dates and the individuals who were present there were some factual details added to the activity logs regarding some activities, observations that occurred during the visits. Those observations, those activities were real. They were not made up. They were things that often occurred, and they were so inconsequential, really. They were things as simple as getting somebody a cup of coffee, warming up a bottle. And those details were put into the activity logs. The mistake that was made was connecting those details with a specific date, because while we knew that they asked for those things, we knew that they asked to warm the bottle up, that we knew they asked to have a cup of coffee, we couldn't connect it with a certain date. And when that came to light, that mistake had been made, we were open about it. We acknowledged it. We brought it to the attention of to the state. We put it in the record. We created a new activity log immediately, which stated that while those observations, activities were true and real, that they could not be linked to a certain date.
supervision, by the very nature that a visitation occurs in our building, is supervised. So that it's probably the most restrictive type of visitation, is having visitation with your child in a small room. Then we make, as an agency, basis of what types of supervision we're going to provide during that visit based on the circumstances of the case. And that can go from being in the room the entire time, to checks, to camera monitoring. Sometimes there's relatives that sit in the room. Sometimes we have foster parents even, I think, occasionally, that sit in.
At times, Help Me Grow workers might come and observe and teach during a visit.
Initially, it was sitting in the room, eyes on. And then generally, as cases progress, there is a, based upon how parents do, how they are performing on their case plan, how they're handling the child, that's when a decision is made by social service staff and as well as the legal staff. Do we need to adjust it, modify it, more restrictive, less restrictive, all that type of discussion goes on.
We have learned a lot from this experience. And part of that learning is confronting the fact that something happened in the security of our own building that nobody ever thought would happen. And as a result of that, we've taken greater measures with our camera monitoring. We've upgraded our whole surveillance system. Every visitation room has cameras now. We created and hired a visitation coordinator, created that position to have somebody who has their pulse on all the visitations that occur at the agency. We have, I think.
We did special training with the state with regards to.
Yeah, we had our state come in, and based on the review that they did of our case record, we had them come in and give us additional training on documentation issues and the definitions. We also have enacted stricter guidelines as far as documentation, what needs to be documented, how quickly it needs to be documented, and we have our CQI department who is monitoring compliance with those expectations, and we've done phenomenal at documenting everything timely. We are one of a few agencies in the state of Ohio who are accredited by the Council on Accreditation. That is a very thorough, time-consuming process to make sure that all of your practices rise to the level of best practices. And we recently went through a recertification of that and were found to be in compliance in all areas, no citations issued, and we actually received notice of that passing, if you will, of that accreditation the next working day, which was like unheard of, because I think we were that good. Our staff, I've been there 27 years, and in the whole time I've been there, never in the past nor now have the children and the families we served ever been a number to anybody. We always have best interest at the forefront of all of our case decisions, and no decision is made by one person. It's made by often a team of people who have their hands on the case, looking at it from all angles and making those decisions. I enjoy the permanency of it. I enjoy seeing a child, because there's so many different forms of permanency for a child. It can be reunification, it can be adoption, it can be going home to a birth parent or going home to a relative. But when you see that child transform from when we first get involved and they come into care and they're scared and so sad and don't know where they're going and what home they're going to, and then you see them over the course of the weeks and months to come, and they're feeling safer, they're feeling more secure, and we're helping with that process, and our staff is just wonderful. I mean, I would not have stayed as long as I have if it wasn't for the leadership that I've been lucky to have, as well as the staff that are there and love what they do.
There's a lot of good that is done every day. There are a lot of children who are saved from very bad situations. There are a lot of services that we provide parents so that they can be stronger. I know that people have asked me, like, why do you do this? Why would you go to work and work like at a place like this? And I generally tell people, we do see evil. We see evil all the time. But what we generally see are people that don't have skills. They weren't taught how to parent. They weren't taught how to nurture. They don't have the resources in order to do what they need to do for their children. Majority of the cases that we work with is we're trying to give that to that family, help them overcome the obstacles, the barriers that they've had in their lifetime, so that they can provide a good home for their family. Yes, there are days that we go home and we cry because we can't believe what we've seen. But for the most part, what we're dealing with is people who are just lost, and they need help, and they need resources, and we help them. And we do that. We do connect them with the services in the community. We help them reunify with their children. If we can't reunify them, we help them come sometimes to a difficult decision to let their child go. And that's a real a part of the job that nobody prepares you for, is to sit in a room and convince a parent that they need to sign away their child forever, and then help them live with that decision, to know that they are letting their child have a better life.
Well, unfortunately, we make the headlines when something goes wrong. We have a staff at the agency that they come to work each and every day prepared to hear and see things that are incomprehensible to most people. No one sees what we see every day. No one sees a staff member picking nits out of a child's hair. No one sees the staff member who's cleaning the dirt off of a little body or holding a trembling child. No one sees the staff member who transports a child back from a visit with their mom and dad, trying to comfort them and make them feel safe. No one sees that. We see that all the time, and we know our staff lose a little piece of themselves every time they come face to face with something horrendous that happens. And unfortunately, they don't do it for the pay. They don't do it for the accolades. They do it because they have a passion to serve other people, and they make me really proud to work where I work, and have been a great support when something does happen. And we're an agency that has always carried on in the face of adversity, and if we make a mistake, we learn from it. We don't try to minimize what we go through, but every April we have success stories about clients that come through the worst of the worst. They come through the alcohol, the drugs, the mental health, and we help them come through that. No one sees all the success stories. They just see the story that's gone wrong, and that's so unfortunate. And that is a message we're trying to get out more, because we're an agency that the community needs, and we need them, and we need them to believe in us.